PCA Practice Test 2026 Personal Care Assistant, Full Course Certification Exam Format. Question 1. What type of questions are most common on the PCA certification exam? Essay questions, multiple choice questions, oral exams, short answer only. Most PCA exams rely on multiple choice questions to test knowledge. Question 2. Which of these is a likely topic on a PCA exam? Infection control, advanced surgical techniques, hospital management, pharmacology research. Infection control is a fundamental topic for all personal care assistants. Question 3. Does the PCA exam typically include situational questions? No, only definitions. Yes, to see how you'd handle specific scenarios. Only if you fail the first part. Only for management roles. Situational questions test critical thinking and application of care principles. Question 4. A behavioral question on the exam might ask: what is the formula for water? Describe a time you handled a difficult client. How many bones are in the foot? What is the capital of France? Behavioral questions look at past actions or proposed responses to human interactions. Question 5. True or false? Some PCA exams include a skills portion where you demonstrate tasks like hand washing. True. False. Many certification programs require both a written and a practical skills demonstration. Question 6. What is the typical passing score for a PCA competency test? 50%, 70% to 80%, 100%. None, everyone passes. Most healthcare competency exams require a score in the 70 to 80% range to pass. Question 7. Which of the following is not usually a section of the PCA exam? Rights and dignity, emergency procedures, nuclear medicine, communication skills. Nuclear medicine is far beyond the scope and testing of a PCA. Question 8. How long do you typically have to complete a 50-question PCA exam? 15 minutes. 1 to 2 hours. All day. 5 minutes. Standard exam times allow roughly 1 to 2 minutes per question. Question 9. The Rights and Dignity section of the exam focuses on the PCA's right to higher pay, respecting the client's privacy and choices, how to argue with a doctor, the history of the Constitution. Client rights, privacy, choice, respect, are crucial exam topics. Question 10. What should you do if you don't know the answer to a multiple choice question? Leave it blank. Eliminate the obviously wrong answers first. Cry. Pick a for everyone. Elimination is a standard and effective test-taking strategy. Question 11. Are true or false questions common on PCA exams? Yes. No, they are banned. Only for the name section. Only for math. True/false questions are frequently used to test binary facts or rules. Question 12. The safety section of the exam might cover how to use a fire extinguisher, fall prevention, safe lifting techniques, all of the above. Safety is broad and includes fire, falls, and body mechanics. Question 13. If an exam asks about confidentiality, it is referring to keeping patient secrets from the nurse, HIPAA, and protecting patient health information, talking about patients on social media, using a secret code for the door. Confidentiality and HIPAA, privacy, are key testing areas. Question 14. Does the exam test your ability to document care? Yes, charting is a critical skill. No, PCAs don't write anything. Only if you are a supervisor. Only in the medical exam. Documentation, if it wasn't charted, it wasn't done, is a major exam theme. Question 15. Which of these describes a competency-based exam? Tests if you can actually perform the required skills. Tests how fast you can run. Tests your IQ. Tests your height. Competency exams ensure you have the skills needed for the job. Question 16. What is the best way to prepare for the PCA certification exam? Reviewing the training manual and taking practice tests. Watching medical dramas on TV. Guessing. Asking the client. Study and practice are the best preparation methods. Question 17. A question about body mechanics is testing. How to fix a car. How to move your body safely to prevent injury. The names of muscles. Weightlifting records. Body mechanics is about safe lifting and moving. Question 18. Why do exams include questions on abuse and neglect? To teach you how to do it? To ensure you can recognize and report it? They don't. To fill up space. Identifying and reporting abuse is a legal and ethical requirement. Question 19. Can you use a cell phone during the exam? Yes, for searching answers. No, it is usually prohibited. Only for emergencies. If you are quiet. Standard testing rules prohibit the use of electronic devices. Question 20. The communication part of the exam tests. Your ability to speak 5 languages. Verbal and nonverbal interactions with clients and staff. How to use a radio. Public speaking skills. Effective communication is vital for quality care and teamwork.